Like she said, I'm Nancy Kaysen. I'm a licensed clinical psychologist, and I practice in Denver. I work with people with a variety of age ranges and diagnoses of autism spectrum disorders. And I started in the field in college in 1990, so I've been doing this for a little while. And if you had told me when I was about 13 that I would be doing public speaking and public speaking about puberty, I would have had a heart attack and died. Still a little bit nervous with the whole public speaking thing, but I'm getting a lot of practice talking about puberty lately in my practice. How many of you are parents and people on the spectrum or have a family member with somebody on the spectrum? How many are professionals in the field? Okay, and then there's probably some overlap there. How many of you have an individual in your family or that you work with who is or has gone through puberty? Okay, anybody have anybody who will go through puberty in the future? So that covers everybody in the room. It's something that affects every single solitary human being who goes through a certain age span. And it's a very confusing time for anybody, and it's especially confusing for people with autism spectrum disorders. And I am a very firm believer that all people going through puberty have a right to have information, education about puberty, because it's pretty terrifying if you don't know what's going on with your body. A lot of people with ASD, as we well know, have trouble with change, and puberty is a time of intense and dramatic change, which can then lead to difficulty if people aren't prepared for it. Who's had the talk? Yeah. Was that the most fun conversation that you've ever had? So, yeah, it's nerve-wracking for everybody around, but I think we can all agree it's pretty important. I don't think people would be in here if they didn't think it was important. I've had families who were not comfortable doing the talk with their child, and so they've hired me to do the talk. So I've gotten some practice with that. I have a 13-and-a-half-year-old stepson. My husband got to have the pleasure of doing the talk with him, with me coaching him from behind the scenes. I also have a 2-year-old and a 1-year-old, so we're nowhere there yet with that. I've got a little time to prepare. So, okay. First part of talking, is that still on? They've dislodged it. Okay. First part of talking about puberty begins when children are very, very young. And actually, I'm already starting to have that talk with my 2-year-old about safety, modesty, and privacy. It's an ongoing conversation that's important for talking with any child. But when you're dealing with somebody with social communication issues, impulsivity, behavior problems, it can take on a much bigger range and scope. Rules should be taught from a very, very early age. And then the reason why is also very, very crucial. Who can think of a rule that doesn't really become established or enforced until children get a little bit older, around 5, 6, 7 years old? Yeah.
Don't run around the house naked.
Exactly. When my kids do it, it's kind of cute. If my 13-year-old were to do it, it would be a big problem. We would all die of mortification, including him. People typically teach that the bathing suit areas are the private areas. And that's a pretty good rule of thumb, because a lot of people who are not on the spectrum learn the variations in the gray areas with those rules intuitively and just through living life. Kids need to be getting a pretty consistent, very thorough education about the variations of that and all of the other rules across the spectrum. Teachers, babysitters, extended family, caregivers, friends of the family. So when there are violations of those rules, they're just taught as a matter of course, and the reasons why across the board. Is it okay for you to touch my arm? Absolutely. But what if I go up to you and I don't know you and I start caressing your arm? Touching your arm, right? Is that okay? Your swimsuit doesn't tend to cover your arm unless you're, going back to the 1800s. So that's a gray area. I work with a teenage boy who he was taught, you don't touch any of the swimsuit areas. Those are the private areas. So we went to the family swimming pool that summer. Typical teenage boy has autism, and he likes girls. And he went up to a girl and rubbed her belly. That was it for the swimming pool for the summer for him. So we learned to contract with him every summer very explicitly, go through all of the rules. It took him losing the swimming pool 3 more times, summers, before this summer where he's trying the swimming pool again. So far he's been pretty successful because we can't risk his family, the rest of his family, his sisters, not being able to use the pool. We also can't risk him getting arrested. My office mate here, Claire, she and I get lots and lots of referrals. We work a lot with adolescents and adults. We get way too many referrals of people who are in the sex offender system because they have violated social and legal norms just out of curiosity, because nobody ever explained to them that XYZ was not okay and the reasons why. A couple of them were lured into doing things that they shouldn't have done on the internet that are against the law. And I have a client who did prison time because he didn't know that it was against the law, and people on the internet said it was fine in the sex chat rooms that he went into because he was curious. So curiosity, normal. Everybody's curious, right? People with developmental disabilities often get treated as if something is wrong with them when they have sexual curiosity. One of the moms that I work with said, my child might be developmentally delayed, but puberty is not. And curiosity is okay. It's perfectly normal. But getting that curiosity satisfied in a socially acceptable way is crucial, and being able to explain it's normal to want to look at girls. It's not okay to want to stare at their breasts. It's normal to want to see what bodies look like, but it's not okay to go into a locker room or the opposite sex bathroom to take a look at people. I had a client who was going through puberty, and his penis was changing. Nobody explained to him that he would get body hair and that his penis would get larger. And so in the men's bathroom, whenever he went to the bathroom, other people had their pants down, so he was looking and almost got into really, really big bad trouble, and that was how he ended up in therapy with me. And so people, the referral to me was, we think that he's going to be a sex offender because he's doing this. Once we got, he has pretty significant communication problems, and so we drew out comic strip conversations, and we talked about it very thoroughly, and I was finally able to get from him that he wanted to make sure nothing was wrong with him. He wanted to make sure that other people had these body changes as well. More thorough puberty education would have been appropriate to help him out. Answering questions at a language communication developmentally appropriate level. Anticipating curiosity. Explaining things very seriously and not minimizing or making a joke out of it. It's really easy when we're embarrassed to just kind of brush it off. Or say, oh, go ask your dad, or oh, go ask somebody else. Maybe the only time that they've worked up the courage and the ability to ask the question that they ask, you want to take those windows of opportunity and be prepared in advance. And there have been times in therapy sessions where people have come in and asked me questions, and I've wanted to fall through a hole in the floor, but I have to suck it up and answer the question. Little note, we were talking yesterday about, well, how do you back up what the family knows? Because I work with so many teenagers and because I've been in awkward situations, I've learned to talk to parents in advance about their family's values and what message they want me to give to their child if they have questions. I work with some families who are extremely religious, and they make it very clear that sex does not happen until marriage. I've worked with a family where masturbation was wrong, and so we talked about those things in advance so I could back up their family, but also talk about issues with them of, well, what are you going to do if they are masturbating and now they think they're going to hell? And they're not likely to get married one day to have a sexual outlet. So kind of getting parents to think through and talk through those issues. And I'm not going to dictate people's family values and religious beliefs and so forth, but I want to get parents thinking about issues. And I also want to know how to answer the clients I work with. If I'm not prepared and a kid asks me a question, I've learned to say, that's a great question. Let me think about it, and I'll get back to you with an answer. And I make sure to get back to them with an answer after I've talked to their parents. But talking through as parents what message you want to send your child and know what your values and expectations are in advance before your child starts to ask questions. With questions. It's okay for my clients to ask me questions. It's okay for them to ask their parents questions. it's not okay for them to ask the school bus driver questions. It's not okay for them to ask the cashier at the grocery store questions. So teaching those boundaries is pretty important as well. I had a client who came to me and very proudly announced to me that he had a new hair in his armpit. He was so excited. And I was excited for him, and we talked about it, and he had questions and wanted to know when he'd get chest hair and that kind of thing. After he left, I was like, well, if he's announcing to me that he has an armpit hair, who else is he telling? So it's like, oh, that's another area that we need to address. Jeanette McAfee has a book called Navigating the Social World. Are you guys familiar with that? She has a really great section in there called Privacy Circles. I'm pretty sure it's in her book, right? But yeah, privacy circles and talking about on the inner circle is the closest people in your life. You can talk to them about anything. The people in the next ring are like teachers and school principal, next door neighbors, maybe if you have a close friendship with them, and then the next ring and the next ring and the next ring until you have people that you don't really tell them anything. And you practice that, and it's a great visual, and it can be individualized. Teaching those boundaries, locker room behavior, public bathroom behavior, which urinal to stand at. Jed Baker's social skills book has, for high school students, I think, has a visual of urinals in a public bathroom and a discussion about which one you use if somebody's standing at one. Yes?
As a mother,
Let me get the microphone. It's being recorded.
As a mother, how do I teach my 15-year-old son which urinal to stand at?
Okay. Well, that's a great question. That book has a visual. So you can show him that if somebody's standing at the one on the right, then you go and keep an empty one in between you. Similar to the women's bathroom, it's kind of awkward if there's tons of toilets and somebody goes into the stall literally right next to yours, like the one here that's the size of an airport hangar. It would be odd if somebody was right next to you. It's that same idea. It's the same idea as in a movie theater. You kind of keep gaps between you unless there's nowhere else to sit, and then you go to an open one. But you keep your eyes straight ahead, and you don't chit-chat with the guy next to you.
okay, but he's a visual learner,
Mm-hmm.
so I would have to literally take him in there and explain that to him.
So then maybe you talk to your school about can you have access to a men's bathroom when nobody else is there so he can go in and practice. Or you get a trusted male in your life to help go into places and practice. Pictures, internet, Google Image has pictures of everything you could ever want. Make sure that you put like a safe search on it or you'll be shocked. Okay.
Dad doesn't like to discuss anything.
Okay. Pictures are great. I'll even get get blocks, and these are toilets, and then get action figures, and then these are the people, and if this guy's here and this guy's here, where do you go? So, and then practice and discussing it in practice, and if you can find access to a bathroom where people aren't going to barge in, then you practice at a public bathroom where you can get free access, where you're not going to get company. So, or if you've got a male friend of the family who's more comfortable talking about it, or another teenager who's more comfortable doing a pure body education thing. Oh, yeah. Ah. Okay. Yeah, and I'm going to take my sweater off because I smell here. Yeah, you don't mind doing that because it's pretty big. And then you have to push the button to unmute. Okay. You had a question?
Well, I was just going to comment about the bathrooms. I have a 12-year-old son who just went to middle school. And another thing to deal with is what other middle school boys are actually doing in the bathroom because they're not all looking straight ahead.
Right.
He came home first week of school and said, I met a distance peer. And I said, what are you talking about? And he said, a distance peer. He stood way far away from the urinal and tried to hit it. And I said, well, what were the other boys doing? He said, they were saying, go, go, go. And so then there's that whole other social part of what other boys are doing in the bathroom, too.
Right. Yeah, I gotta love middle school, right? And that's where I teach my client that what other people do, they're really good at doing stuff like that, But if you do it, you're the kid who's going to get caught and get in trouble, because people on the spectrum it's like they're the one who always, when the teacher walks into the room, they're the one who's doing whatever the misbehavior is. So I caution my clients to be really careful because they're not good at being sneaky. She had a question, and then she has.
So my son is 10, and I still take him in the women's bathroom with me, just because I'm scared to let him go in the men's bathroom, like at airport or restaurants or anything.
Right.
When should I start?
Go ahead and start in safe places. Now, say if you go take them to a museum and it's not very crowded, that's a good place. And then you stand right outside the door and keep it propped open a little bit and yell in there something like, honey, I'm waiting for you right here. Let me know if you need anything. So if there's any weirdos in the bathroom, they're alerted that mom is keeping an ear out. You teach him ahead of time to yell for help if he needs help. And if you have to go in there, just yell, Mom coming through, and you go in. That's what my other families do. Also, so many places have family bathrooms now, too. So you can go ahead and get him practice by sending him into the bathroom with you waiting outside, but you know that there's not going to be anybody else there. So it's practice going to the bathroom in the public and in a public bathroom, but you don't have to be in there with him. So. So she had
I just want to let you know there's a website that has a urinal game on it, which actually has, you can choose which urinal, and they have all the different scenarios of where another person would be. So I just wanted to, for the person who had a visual learner.
On the website, there's a website with a urinal game where you pick which one you're going to use.
So if you look for urinal game, it shows, you can Google search urinal game. There isn't really that many.
That's great. Okay, I'll take 2 more questions, and then I need to move forward. We could literally be here all day. This presentation is normally 3 hours.
For a visual model, if you go on YouTube, type in urinal protocol, it's set to music, and it's a little short video that goes through all of the steps of using a urinal.
That's great.
With middle school age boys.
That's awesome.
This doesn't actually have to do with going to the bathroom necessarily, but one of the things that we struggle with is teaching the boundaries and appropriateness. Why is it okay for a guy to walk around outside with no shirt on?
Yep.
Or why can I walk around my house in my underwear when these certain people are here but not everybody else? And
those
I think
gray areas.
The same thing, if we're going back to the bathroom situation, you can't articulate every single situation. So, my son would probably just not go to the bathroom all day because he couldn't figure out, I'm not supposed to look, I'm supposed to do this, but this person's doing it, and I'm not supposed to tell on them, and I'm not supposed to say anything to them,
Right, and the anxiety level goes up, which is why, I've had kids where it's written in their IEP practicing using the bathroom because they've used the nurse's bathroom, which we often leave as a backup. If you're not comfortable going in the regular bathroom, go up to the nurse's office. You can use that one in privacy. But practicing in a safe situation in the bathroom or the locker room at school. Middle school also, a lot of schools start having you, do you want to get the microphone? Start having people dress out for gym. And then even taking showers, and so going through the what if your clothes get all wet? What if somebody taunts you in the shower? What about bullying? What about if you walk out of the locker room and you realize that your shirt's on inside out? What, just going through every what if that you can think of to prepare and practice as much as possible. If you can go to a rec center and practice locker room skills. Consistency across people as far as giving a consistent message and being able to practice across people and being able to practice across settings are pretty important. One thing that's also important is teaching not just medical terms for puberty, sexuality, issues like that, but also teaching slang and euphemisms. I've had clients get in trouble because they didn't know what meant what. And somebody used a euphemism and then they got into trouble, or they said things that they didn't know what they were talking about. There's a book called Girls and Asperger's, and one of the personal essays, the woman talked about how she didn't know how she got pregnant because she had been told don't sleep with guys. Well, she didn't fall asleep. Yeah. So nobody had taught her specifically what sex was and specifically what sexual acts led to pregnancy and how to prevent that. And it can happen the other way, too. If you say don't sleep with girls, you're not sleeping when you're having sex, ideally. So, moving on to actual puberty. You start teaching it as honestly and straightforward as you can with safe, trusted people as young as is possible for them to know what's going to happen. I did this presentation a couple of weeks ago, and there was a mom of a teenager who was also a fourth grade teacher. She said every single year there was a girl who thought she was going to die because she was bleeding to death. Nobody had told her to expect her period. And then somebody else told me about a girl who didn't realize that she would get it every single month because nobody told her it was a recurring thing. So making sure that you cover all of the topics, which I'm not going to get into. There are some fantastic books out there. This one is my favorite for teaching about puberty, and it is extremely frank. It's Sarah Atwood, and it's on my last slide too. Tony Atwood's wife, and they're from Australia, and I find Australians tend to be pretty frank and upfront. It literally covers everything. I have parents who copy the sections they want their kids to read and go over those with them. I have clients who are more cognitively impaired who can't read. This is written at a high level because it's for people with Asperger's. It's called Making Sense of Sex. Sorry. It is incredibly frank. You may want to read it as a primer and give you language for how to explain it, and then maybe get a pamphlet from your doctor's office. We go to Kaiser, and they have a fantastic pamphlet that's very well illustrated, but it gives you language and gives you the topics to cover. Making sure that you are incredibly thorough. One of the issues that's come up with a lot of the boys that I work with is they were not prepared for nocturnal emissions, and they were mortified because they had started wetting the bed, and they were embarrassed because they thought that they were peeing themselves at night. And so explaining to them that this was a normal part of growing up, and then what to do about cleaning up after themselves and making sure that they take a shower in the morning and not just leaving a mess for somebody to deal with. Or asking for help to clean up if that's something that they can't handle. There's a book, I can't think of the author, I think it's listed on my last slide, Taking Care of Myself. It is social stories and a lot of explanations on how to do visuals for people who are more cognitively impaired and need things broken down to a much more simplistic level. And it covers everything from nutrition to hygiene to safety to masturbation to body changes it's very thorough. Yes?
Sorry, could you repeat what that?
It's called Taking Care of Myself. Mary Robel, W-R-O-B-E-L. Thank you. Let's see. A lot of my clients, and I used to work a lot in group homes and schools, and masturbation was frequently an issue. And what I run into is a lot of my clients, because they're developmentally disabled, any sexual urges were seen as perverted and bad, and they were getting in trouble. And it broke my heart because it is a normal urge for people to want to masturbate. Whether it fits with your values or not, whether or not it's okay is completely different, but it's a normal human urge. And so a lot of my clients have needed very safe, trusted people to talk to them about safe places to do it. When it's okay, you do it in your bedroom or bathroom when nobody else is in there and the door is shut. Some people will say only at nighttime. Okay, whatever fits in with your family. But having it very clearly spelled out, because we don't want somebody getting in trouble because they decide that riding home on the bus feels good because of the vibration of the school bus, and they decide that that would be a good time, and the next thing you know, they're expelled from school. I've had a teenager who I worked with who a girl wanted to be his girlfriend and asked him to make out. He misunderstood what making out meant, and he was in the sex offender system for 4 years. He just touched her, but the cops were there within 30 minutes because he didn't know what make out meant, and he took it to heavy petting, basically. So being able to really explain when you have sexual urges, what's okay and what's not, and when it's okay and when it's not. I have some other books that will be listed on the last couple of slides that do a fantastic job of explaining those rules. I think, the Asperger's Syndrome and Sexuality does a really, really good job of explaining what to do and what not to do, and when sexual feelings and urges and activities are good and when they're not. Independence and responsibility during puberty is a great time to bump up expectations for that. I find that a lot of my clients want to be more independent, want to take on more responsibility, or they want more freedom, and so we raise our expectations. Okay, you want freedom, you need to do this and this and this. A lot of it with self-care is really, really important. The adults that I work with oftentimes have difficulty in the job place because their hygiene is poor. So beginning to teach that, because we know with puberty comes a lot of physical changes, including body odor, needing to groom hair, needing to use deodorant, making sure that you're truly washing with warm water and soap. Acne can become an issue if grooming is not done appropriately. And then something that we were talking about as I was preparing for this is typically developing teenage girls. Grooming is a huge part of the social relationship in groups of girls. When I was growing up, I learned to do hair, makeup, clothes, pluck my eyebrows, all of that from my friends, not from my mom. My mom was clueless about those things, and if it weren't for my friends, my mom would have been okay for me to have a ponytail and a T-shirt and jeans through whenever. And sneakers, and that's not how I wanted to look, and I learned it from my friends. It's okay if you want to look like that, absolutely, but I cared about fashion. I wanted to learn to do my hair and use a curling iron, and so girls with Asperger's who don't have that social world, they're giving them the opportunity to be able to learn about clothes, learn about hair, learn about nails, learn about shaving, plucking the eyebrows, doing makeup, things like that. I have a client who is very into fashion as her special interest. She gets all of her information from her older sister, who's her best friend. If she didn't have her sister, my heart would hurt for her. But her sister's fantastic and includes her in all those things, and her sister's a model and really has an opportunity to explore that with her. With introducing the idea of sex and talking about puberty for the opposite sex, I have clients where they need all of the information as early as possible, and intellectually and developmentally they're ready for it. I have other clients who are not ready for it. I have a client who, as he was ready to learn about puberty for males, that's what he was taught, and taught very explicitly and with lots of pictures and discussion. He was given very basic instruction about girls. Basically, the girls got breasts because that's what he could see, and we left it there. Because he wasn't ready, and had we introduced those topics, he gets very obsessive about things that he finds interesting, and it wasn't a topic we wanted him to obsess on. He has shown absolutely no awareness or interest in talking about sex, so beyond making sure that he understands information to keep him safe and from getting in trouble, we haven't really gone there yet, because he's just not ready and not showing any interest. Other people, however, on the spectrum, I have clients who have girlfriends, I have clients who have boyfriends, I have clients who go to the prom and homecoming, and it's been a fantastic opportunity to talk about flirting, friendly teasing. What else could you use it as an opportunity to teach? Compromise, absolutely. It's a fantastic time. I have a client who hates Starbucks. His girlfriend loves Starbucks. And they go to Starbucks first and GameStop next. And he even buys now. It's really sweet. What else is it a good opportunity to teach? Compliments. I have clients who never gave a compliment in their life, and now they're learning to say, "You look nice." It's really great, and it's generalizing to other people around them to build conversational skills, asking questions about other people, responding, not just talking about their specific interest, And it's really a great opportunity to build a lot of pro-social skills because suddenly they're motivated. Flirtation versus friendly teasing, it's also a really good discussion point at that point in time. A lot of my clients think that all teasing is mean teasing and bullying, so they finally get an opportunity to really and truly discuss and explore friendly teasing. Social supports and chaperones. A lot of my clients want to start going to parties and school events and things like that, and they don't want mom and dad right there. You guys having fun? Are you behaving? Are you doing what you're supposed to do? You guys are a little bit too close. You need to move, move, move. Don't touch him. So, and I have clients who are like, Mom, go away. And so what's come in handy is siblings as chaperones, as school staff as chaperones, friends of the family, other teenagers for group dates. I have a client whose brother graduated from their high school a couple of years ago, but he still has younger friends who are still in the high school who watch out for my client and busted him when he commented on a girl's breast. He thought that her shirt was too low and went up to her and told her she needed to cover up her breasts because she was sending the wrong message. So we had to work on rule police around that. We also found out from the friends that we weren't going to see, obviously, anywhere else, that he was staring at girls' breasts and using a cell phone to take pictures. So we wouldn't have known that otherwise. And so we started working on glancing versus staring, because you can't tell me that men don't, and teenage boys don't glance at girls' bodies. They do, perfectly normal curiosity, right? There's a big difference between glancing and staring. So we practiced glancing. He had a little bit, his eye contact improved dramatically in adolescence, and it would have been nice if it hadn't improved quite so much. But we got the feedback from the friends, and it was nice because they were also able to go up to him and say, dude, don't do that. If you want to look at her, just kind of glance and keep walking. But the feedback from the peers was so much more powerful than it was from us. Because with me, they're like, yeah, Dr. Nancy, whatever. But they hear it from their friends or their brother or their brother's friends or their sister, and it carries so much more weight. Yes?
One of the things that maybe is difficult for boys is, there's this thought that they need to do specific things for a girl that they like, even if they're not dating, like flowers and notes and
right.
calling and texting. I think that, at least with individuals on the spectrum, it can get out of hand.
And turn into stalking when the girl becomes the special interest.
Right.
Yeah.
So, and then they can perseverate on it, and then it gets really out of hand. So, how do you, and it kind of goes back to the whole what's okay and what's not okay, walking around with a shirt on or not.
Right.
How do you explain to them what is okay? When is it
Right.
okay to text?
Right.
5 or 6 times to a girl versus 100 times?
Right. And it's never okay to text a girl 100 times. We make that pretty black and white. But there's a lot of gray areas as far as the social communication. If they're friends and girls text girls that much. But in the boys, initially they do, but it seems like it declines. But having that ongoing discussion and getting peers involved in the discussion of what's stalker behavior and what's not. I also caution my clients to err on the side of being almost prudish with their behavior, because they're the ones who get in trouble, whereas their peers don't, because their peers pick up on the gray areas and the nuances and so forth. So kind of a hard and fast rule. If you ask somebody to do something with you socially 3 times and the answer is no, or I can't, or I'm busy, or whatever, I've got to floss my goldfish, if you get that answer 3 times, the answer is no and leave them alone. They're no longer an option. Discussing social rejection, I had a poor client who, at the beginning of our session, he got a text from a girl, will you be my boyfriend? And he's like, hell yeah. By the end of the session, she had broken up with him. The entire relationship was via text message. But it was a great learning opportunity because we discussed text messaging. We discussed what does it mean to have a girlfriend, what does it mean to have a boyfriend, and then we discussed breaking up. And apparently in middle school, relationships last like the life of a fruit fly or less. And so discussing rejection and that there will be somebody else, and it's not the end of the world and so forth. But there's not a hard and fast answer about flowers and texts and gifts and things like that. It's all gray area. And so it's open, honest, friendly communication, not lectures, not you're going to get in trouble, trying to get peers involved in the discussion of what's okay, what's not, and really picking up on those very subtle nonverbal cues that something's not welcome. If you give a girl flowers and she's all, oh, thanks, and that's it, then probably she didn't want the flowers, even though she said thanks and smiled, because the hidden message was she didn't continue to have a conversation with him, she didn't ask him about his weekend, she didn't reciprocate with giving him a gift, she didn't send him a note, she didn't touch him on the arm. All of those clues that say that somebody's not interested, even when she smiles and says thanks. But it's not a straightforward conversation.
Dealing with rejection, my son asked to grow out.
Uh-huh.
She said, yes, I'd love to go.
Uh-huh.
But the mom said no, because you're not dating until you're 17.
Right.
How do I explain to him, she wanted to go with you, so please don't feel rejected.
Right.
It's just that her mom is not allowing her to date until
Right.
she's 17.
Yeah. Well, you have the discussion of she really wanted to go out with you, and it's okay to feel rejected because her mom rejected you and all boys. And it's okay to feel really disappointed, but you can be her friend. And let's talk about what friendship is, and let's talk about how friendship with girls is actually much more valuable than...
Well, I mean, they're like boyfriend and girlfriend at school.
Okay.
Mom doesn't want them to go out
Right.
and date until she's 17.
And then if that were my client, we would really explore the disappointment and the feelings of rejection because mom rejected it for the girl, and that it is really sad and disappointing. And how does your girlfriend feel? What does she have to say? Are you talking to her about her feelings about this too? Is she okay with it, or does it make her upset too? It's a great opportunity to build compassion and empathy and for him to practice discussing his feelings in a relationship and talking about boundaries in relationships, that all relationships have some degree of boundary. But just acknowledging it, you're not going to prevent him from feeling rejected because he'll feel whatever he's going to feel, but more validating that emotion and putting it in the context and then open it up as a discussion that different families have different values. Okay. And using it as an opportunity to talk about those gray areas too. Teaching very clear social and physical boundaries before a date is also really important. A lot of my clients and families, we discuss just words of talking, compliments and conversation and what do you say and you look nice. And we talk about okay touching and not okay touching. And when those times are okay to touch, when it's okay to touch, we talk about social boundaries around pictures. It's okay to take a picture of your girlfriend. It's not okay to take 200 pictures of your girlfriend on your date. It's not okay to take a picture of your girlfriend's breasts. It's not okay to take a picture of your own body and text it to somebody else. We talk about phone calls. We talk about what it means to be a girlfriend.
I'm sorry, unless you're a congressman.
Oh, right. Oh, which brings me to, again, with boundaries. No, that reminded me of something that's good. I had a client who he liked to get attention by telling jokes, and it was how he got attention from girls and boys at school and appropriate attention until he told a wrong joke because the site that he was getting them off of had really funny jokes, but a lot of them had sexual and or political innuendo to them. And there was a lot of overlap there. He found the whole cache of Bill Clinton jokes. And so we spent 10 minutes of every session going through his jokes, and I would help him identify which ones he could and couldn't tell, and to which audience, that he could tell some jokes to his teachers and some to his peers, but not the same jokes. His parents were like, yes, please do that with him, because our ears are bleeding from the jokes. So social events and get-togethers, I know in Denver there's a couple of different organizations, like ARC puts on some parties. There's another organization called Rise that puts on parties for teenagers. But finding opportunities like that, not just through schools, for social get-togethers. It's pretty important. This is when it gets really complicated. I have clients who very much want to get married and have children, and I see no reason why that won't happen. I have other clients where the thought of sex grosses them out, and they say, well, I'll do it once because I want kids, but I'm not doing it otherwise. And that's a normal range of humans as well. There are people who are neurotypical who have no desire to have sex. That's okay. The whole range of normal human experience, being able to talk about it at a developmentally appropriate way, to normalize things, to help your child or whoever you're working with understand what's going on. People with ASD often date and have relationships and get married and have children. We see a number of people where there's one or the other of the parents who are on the spectrum, and we're working with their child or we're working with them. We diagnose an incredible number of adults. We get most of the referrals for adult evaluations in Denver, and quite a few of them are married. And sexuality is often an issue. And so it's not so much the sex that's the issue, it's the social communication around it and the relationship around it that is often talked about, of making sure that the relationship piece is there and the communication is there and the emotions are there. People on the spectrum can be homosexual. People on the spectrum can be transgendered. Being able and willing to talk about those issues is important. People on the spectrum have questions about those issues and being able to talk about it. I remember my stepson got in trouble for calling somebody gay when he was like 9, and we had that discussion then of what that word meant and the people in his life who are homosexual and how that becomes a slur. And it was a great conversation because when we were like, well, what does that word mean? I don't know. So it was a really, really good conversation, and he's never since called anybody that. Talking about emotions. Talking about that it's not just about the physical piece of it, but really understanding the emotional piece of it to make sure that people aren't pushed into relationships any faster than they want to, and making sure that their partner down the road or currently is also in an emotional relationship with them. People on the spectrum can get hurt emotionally just like anybody else can. Sensory issues. I need to talk about that with just entering puberty as well. I find that a lot of clients, their sensory issues often get exacerbated as their bodies are changing so rapidly. So it's something to be aware of. Teenagers in general and specifically people on the spectrum often need a lot more sleep during adolescence because their bodies and brains are growing so much. But also, physically, sensory processing, there's a lot more input, so getting a rest and getting a break is really important. Exercise is really important. I have a lot of clients who suddenly they can't tolerate certain textures and clothes and so forth, and getting them involved in their own shopping and laundry can be helpful too. And then for girls with getting periods and dealing with cramps, that's a whole sensory experience. And then figuring out which pads or tampons or choices and bras and things like that are tolerable as far as sensory input is important. I had a client who, as far as sensory-wise, and I have permission from parents to talk about clients. I don't talk about clients without that permission, even disguising their names. But because body hair was so uncomfortable for him with his clothes against it, he went into his dad's bathroom and used his razor to shave it all off and badly hurt himself. And it was bad. We're like, his parents saw blood on his leg, and they're like, where's that coming to? And his dad took him into his room, and he just was a bloody mess. And so they had to work with him on dealing with the sensory issue of making sure that he had comfortable underwear and letting him wear pants that were comfortable for him and helping him with grooming and so forth. But it's a pretty big sensory experience to go through puberty and adolescence too. Talking about boundaries. Social and legal boundaries is an ongoing discussion. It's okay to be naked in your bedroom. It's illegal to be naked on a bus. It's okay to take off your clothes in the bathroom, but not the bathroom in school. It's okay to compliment somebody's hair. It's not okay to compliment somebody's private parts in public. And it's okay to say somebody has a pretty dress, but not okay to say, oh, I can see your bra through your shirt and it's really pretty. It's, so making sure that you have all these discussions. And then the internet, I can't spend enough time with families talking about internet safety, making sure that their child is protected because there are predators online, and webcams open up a whole new world of ways that people can be put in situations that result in very, very, very bad outcomes. Talking with your child or your client or your loved one about readiness for sexuality, for any kind of sexual contact. And it's not a single discussion. It is an ongoing discussion about readiness for relationships, for dating, for any kind of sexual contact, for making out, for holding hands, for hugging. Oh, and then there's all kinds of rules about hugging and when that's okay. People on the spectrum can get pregnant or get someone pregnant. People on the spectrum can get sexually transmitted diseases. Girls can get yeast infections. You don't have to be sexually active to get yeast infections. And so being able to know what symptoms and signs are and what to do and who to talk to. And then emotions. Research shows that there is a very high rate of emotion, of affective disorder, depression, and anxiety disorders with people on the spectrum, especially in puberty. Temple Grandin talks about how horrific that experience was for her and said that if she could go back and, if she had been on the anti-anxiety meds that she got on later in life, it would have been such a different experience for her. I suspect it's a pretty high rate for all teenagers. But that's when we get teenagers, it's usually because they're depressed and or anxious as far as treatment. Emotions and behaviors goes on a big roller coaster in adolescence. There's also that very normal human urge to push your parents away and to just get aggravated for no reason whatsoever, to be irritable for no reason whatsoever. So giving the tools for, if you're feeling really grumpy, it's okay to say, I'm having a grumpy day, just leave me alone. And so and then leave them alone. Let them go to their room and listen to music, but making sure that those emotional needs are met also, and predicting it as a part of talking about you're going to be going through puberty in the next few years. Your body will be changing, but your brain is going to be changing dramatically. So that's going to affect your mood. And you may have days where you don't want to be around anybody, or you may have days where things just want to make you cry. You may have days where everybody makes you mad. You may have days where everything is hysterical. Being prepared for that. I have clients who think that they're going crazy. And when I say, no, you're going through puberty, which is kind of the same thing sometimes, but normalizes the experience that every teenager is feeling like this and it's okay, and these are things that you can do to feel better. Eat healthy. Get enough sleep, get exercise, have leisure activities, maintain your hygiene. I have a client who after 2 weeks, we finally got him to take a shower. He's like, wow, I feel so much better. Yeah! Do that every day. Every day? All right, every other day, but please, more than every 2 weeks. It's normal to have increased conflict in any adolescence. It's not necessarily that your child is regressing into previous behaviors, but it's also a great time to work on conflict management, anger management, anxiety management. And if you need to, make a referral for a therapist who has experience dealing with emotional disorders in people with autism spectrum disorders. Refer to a psychiatrist if you need to, but make sure that they have experience with people on the spectrum, because otherwise the outcome tends to not necessarily be all that great. I have a lot of clients who want to go to college, who want to grow up and move away and so forth. I have a lot of clients who want those things and they scare the bejesus out of them. It's normal human experience, right? It's scary to grow up. It's even scarier for people who don't handle change very well. So preparing for that and practicing for that. But some of my clients need a lot of reassurance that you don't have to move out when you turn 18. I had a client who truly thought that the day that they turned 18, they'd have to pack their bags and leave. And I don't know where they got that idea, because their parents were like, no, you won't even be done with high school yet. But talking about those things, I have a lot of clients who feel pressure that they have to get a job, that they have to go to college. I have a client who can't even read, who thinks that he's going to college. And it's been a big discussion because his older brother moved away and went to college. And so really talking about how his future will be different from his brother's future. His brother didn't move away and go to college. They still share a bedroom, but his brother's going to college. And so he thinks that that's going to be his plan. And so really making sure that your child knows what's in their future and is a part of that discussion. It's part of self-determination. Discussing their beliefs, discussing their fears, acknowledging it, talking about how you were scared about growing up. And expectations shift also, which is a big struggle. What's cute and accepted in little kids is not so cute and accepted in people as they get older. We get a lot of teachers who are like, well, they're 16, so they should be able to. They ought to be able to. Well, that's not okay at this age, and they forget oftentimes that my clients are functioning at like a 7 or 8-year-old level, and what they're doing is incredibly developmentally appropriate as far as social and emotional development, but the world treats them very differently. So addressing those shifting expectations with caregivers and also with your child or with your client, and having that as a part of the discussion about growing up. And being very aware of chronological age versus social emotional age. Let's see what time it is. 10 till. And so these are some books that I like, that I use frequently in my practice and regularly recommend to people. And then this is a great time for questions. And throwing my notebook. She's got the microphone.
You were talking about hugging. My son is in 5th grade now, so we're getting to that area where he used to hug his friends, even girls, but now girls are starting to develop, and you can see, even though they know he has autism, they know he's on the spectrum, they're very aware, it's making them uncomfortable.
Right.
So do you have any ideas? I mean, we've tried to create, for him, rules work, so we've been trying to create, lists of rules of when it's okay to hug, when it's not okay to hug.
Right. So rules are great. Writing them down, are they written down rules?
No.
Yeah, write them down, because we know people on the spectrum tend to process things better when they're visual than when they're just auditory. And then rehearse and role play, or go through pictures of people that he knows. Is it okay to hug this person? It's grandma. Of course it's okay to hug grandma. Grandma's female. Okay, so is it okay to hug the principal of your school who's female? No. Is it okay to hug this person? And go through pictures and make it kind of a game and see if you can trip them up. Also talk about why, because it helps to develop that perspective taking and the understanding of the gray areas of social norms.
And I think that's part of it, because he will say, but I like them. But in his mind, liking them is not.
Right, and then do you have all...
It's more, I
right,
think
he likes them.
Yeah.
Yeah, and then do you have alternative replacement behaviors? That it's okay to give a high five, it's okay to give a fist bump, it's okay on a very rare occasion to give a side hug. It's so you want to have replacement behaviors. You can give word hugs. I really like you. It's word hug that we've used for some of my younger clients. So develop compliments so you can let people know that you like them through your words or through your actions other than hugging. So you can show someone that you like them by holding a door open for them or picking up something that fell or giving them a compliment on something that they did. Present it in social stories. So again, it's written and illustrated, because what's processed verbally is processed differently when it's visually.
Thanks.
Yeah.
The other thing is sometimes there's an underlying issue that might be related, like perhaps if he enjoys from a sensory perspective.
Good point.
That's part of it.
Yeah.
The other issue is what can you put in place from a sensory perspective that might be a replacement, and how can you add that into the kind of teach him what he needs his body moving.
And she's presenting on sensory issues later on today, and it's a really good presentation, so you'll want to come to that, too.
Start collecting, because the visual is very important, start collecting those rules. Have a book on dating, have a book on hygiene. So
yeah.
as things come up, start writing and have those books by category so they can go back and reference.
So he has his own policies and procedures manual. Yeah, that's great. But then you may want to have a notebook of the gray areas and all the exceptions to the rules and the guidelines, because they start becoming guidelines instead of rules, too. Yeah. Mm-hmm. That your whole house would be papered in rules. So, but yeah, having it posted for the basics is pretty important, too.
My question is about, my son is 11 and starting to go through puberty, but he's lower functioning. He's got some verbal skills, but I think he's still considered nonverbal. And so resources for kids who don't have the verbal skills.
Right.
And
what's his receptive language like?
Better than his spoken, but still pretty limited.
Okay.
I mean,
so
he's considered a low-functioning kid.
Okay. The book, Taking Care of Myself, has a lot of ideas for parents about how to teach things using
Text for puberty?
Basically, it's got some sections where it shows, like, you can have a shape of a human body, an outline, and then you have, like, a hand that you Velcro, and you put, and, you know, there becomes a task of showing, okay, where's an okay place to touch somebody? Where's an okay place not to touch somebody? And that the touch is a pat, not a caress. You know, and it's not okay to touch people's faces pretty much anywhere but their hands and maybe their shoulder or arm for a pat. But keep it as visual as possible and very simplistic and a lot of repetition.
I have one of those questions that's probably going to make you feel squirmy, but if I can't ask you, I don't know who I can ask.
Okay, go for it.
And I'm sorry for everybody, but I really need to hear this. Okay, I have a 15-year-old and a 17-year-old, both males, both Asperger's. My 17-year-old is ready to start college in 6 weeks, playing in a rock band. So he's really into the social world. He's extremely naive. We've worked on a lot of things, but the sexual interest is there. And with both boys, they're both really into video games. So do you know that online there are anime-type characters that you can control their sexual movements with toggle switches? That was, you know, we walked in.
I had a client who proudly told me that his sim lost his virginity.
That one? Well, they've run into that, and not to mention the computer viruses. Thank God they're not STD viruses.
Yeah.
We're getting...
Your computer might die of it, but you won't. Right.
You have to put in that perspective as you're trying to get rid of the Trojans and all that are now in your computer. Okay, so I overreacted because I was so, and it wasn't about the sex. It just took me by surprise, and the whole computer stuff, with the dangers with that. So I need to undo that and let them know that it's fine to master. Our values are it's fine to do things like that. And I've suggested that their dad could take them and buy them some materials. I don't know if in this generation, if the Playboys, et cetera, do that for them anymore. So what are visual sexual materials for pleasure that you would recommend for somebody who's on the spectrum?
I have clients who do anything from hoard their mom's Victoria's Secret catalog or the Sears catalog that comes in the mail. I have a client who's supposed to not be left alone at any point in time, and so his staff, to build independence, let him go into the convenience store by himself, and he went home with a hustler, which his mom was so surprised to find in his bag, and it's an individual preference for what works. I would be careful of what's on the internet, though, because I have with the Sims or whatever where they can have simulated sex. They're also paired with chat rooms with people, and I had a client who was getting chatted up by a single mom of 6 kids who lived in a trailer in Tennessee, and it was so bad that the mom of my client had to threaten a restraining order against her to get her to leave her son alone. It can get pretty icky on the internet, and if they're socially naive, the chance of getting roped into something that could lead to problems. And I could tell you stories that make your hair stand on end. I would recommend against anything sexual on the internet, simply because if you're not there to monitor it, and then the risks, for your computer to get diseases. Dad going to the store to buy a Hustler or Penthouse or something like that is much, much safer as far as it's not going to get them arrested unless they're like showing it to kids on the playground. They need to know that it needs to stay in their bedroom. Oh, yeah, dirty.
You mean like basically soft porn?
Yeah.
That's serious. Okay, well, that's an idea. I hadn't thought about that. But it would be...
Where it's a DVD rather than the internet, yeah.
Thank you. I hadn't even thought about that. I don't know why I hadn't. That's
because
Thank you.
it tends to be marketed towards men, not towards women. So, but yeah, Dad can take them to the store, the adult store, and help them buy some videos that aren't going to, because there's some stuff out there that's way too hardcore, and you don't want to freak them out or open doors that haven't been opened. Or also very degrading to women, or yeah. I mean, which we won't get into that discussion of those videos potentially being degrading to women no matter what, but yeah.
I'm a parent, but I also work at a prosecutor's office, and you're warning everyone about, I think, teaching the children appropriate outlets, because we have an 18-year-old rushed to prison for attempted rape. And my boss is very compassionate. She actually has a child on the spectrum, and trying to do what she can do, but we
Right.
the whole community all, with attempted rape, pulled her down.
Right, it's awful.
I was going to rape her, yeah. I mean, he didn't know.
He didn't know. He wanted to have, right. Right. And talking about sexual abuse, talking about rape, talking about no means no, talking about you can't assume that consent is implied because because you were doing heavy petting, it doesn't mean you get to do everything. Really, really understanding and talking about those. You ask permission before you do anything, because once they're in the legal system, I've been an expert witness in a couple of cases, the judge does not care. If they know basic right from wrong to be competent to stand trial, that's it. That's all they're looking at. And yeah, I've had clients literally, truly do prison time, not just arrested and spend a few days in jail. I had a client who spent 18 months in prison, medium security prison, because he got roped into something through the internet. You can't be careful enough. Yes?
My son is 15. He's high functioning. However, he's way behind socially and emotionally. And it's like the sex hasn't come up with him. So I really don't know where he is. We haven't had a talk about anything. I mean, he has the Sims. He has Sims or whatever. I don't know the Sims games that he has on the PlayStation. They go to the bathroom, they do those types of things.
Double check it just to be on the safe side.
But in other words, obviously his body is changing.
Right.
He's possibly having wet dreams. And
Probably, if he's 15.
If he's 15.
Yeah.
And
starts
I
at
don't
around
know.
13.
It starts around 13?
Yeah.
Wow. So I guess not knowing, because of being a female, I don't know how to approach him. And so I guess the books that you have as recommended readings, are some of these books, would they be good for him to sit down with him and go through these books and read about your body and the changes and what's going to happen and
what is happening, yeah.
And what is happening and about masturbation, because obviously all boys do it. I mean, it's a normal, to me, it's just a normal part of them growing. I don't want him to feel, let's see.
You don't want to feel like he's doing anything wrong, or
right.
That,
and I don't know if he's masturbating. He could be. He could not be.
And it's okay as mom to ask those things, especially if he's really, really young socially and developmentally. And you can say, you don't have to answer me if you don't want to, but if you want to ask me questions, this is a normal part of human sexuality. This is something you can talk about it with me. Some kids think that they can't talk about it with their parents because their parents don't bring it up. We know people on the spectrum aren't necessarily good about asking personal questions. And so if you don't bring it up, they may have questions that just aren't getting answered because they're not asking them. And he may have gotten the message from you that you're not comfortable talking about it, so it's just not talked about. And so it's okay to use a book to bring up topics and ask leading questions. Do you think about girls? And if he says, yeah, well, what do you think? Because he probably thinks about girls because the girl who sits next to him has a really cool binder that he likes or something and may take the question very literally. But open the door of asking him, well, what do you think? Do you ever think about girls being pretty? Do you ever think about having a girlfriend? What else do you think about with girls? And if he's just not there, like a lot of our clients who are socially and emotionally very young, it may not have crossed his mind yet, but you've opened the door for it being okay to talk about with you.
Okay.
And maybe make sure that there's one or two other safe people to talk to, and let him know if you ever have any questions about these things, you can ask me.
Okay, because he's not in school, so he's at home, and the school sends someone to our home to teach
Well, I'm sure
him.
he sees girls in the world, though, or boys,
or on television,
or TV, or movies. Yeah.
Yeah.
We've got a question here and a question back there next.
Than he is socially and emotionally. And my husband has tried to sit down and talk to him about these specific things so that he's not shocked when things happen. But he just shuts down and he won't talk to him, so he can't even get the conversation going.
Because he's a teenage boy. Yeah. My stepson keeps hiding the pamphlet because he doesn't want to talk about it, and my husband keeps talking about it. He's like, no, my ears are on fire.
And he's not a reader. He doesn't enjoy to read. You can't get him to read, so it's not like you can go, okay, look at this book and then ask me any
There are
questions.
some books that are more illustrated. There's one that's out of print that I have in my office that I love because it's a comic book about puberty and sex, and you can get the gist of it without even reading the words. I don't know if anything like that exists now, and then I found it randomly a used copy of it on Amazon for like 61 cents, and I was all excited because it was basically a comic book. But even if he's not talking, he's listening. Or I like the conversations where they're eavesdropping, and you want them to eavesdrop, but they don't know that you want to. So my husband and I will have conversations knowing our stepson is in the next room, because we know he won't talk about it with us, but we want him to hear it. So that works pretty well. Also, walking, face-to-face discussions about things that are, this is uncomfortable for some of us to talk about. I have a little bit more practice, but my mom always got my brother to talk by having him wash dishes with her or go for a walk with her. So go for a walk, go for a hike so you're not face-to-face, and then start bringing up these topics. We've got a question back there, and then we can come back up here. And then once we go, I don't even know what time it is.
It's like 12:10.
Okay, so once it's 12:15, then
mine's just not a question, more of a comment. There are some books that you can use that I use when I teach these classes for adolescents, and especially boys. And one is called 1001 Questions Boys Want to Know, and another one is called What's Going On Down There. And it's just for kids. And it's a really good, you can kind of leave it on the table kind of a book, and it addresses these kinds of questions for kids, and it gives them a way to read it that's not just a textbook. It's got kind of the little thought bubbles, thinking bubbles, and the word bubbles, and the kind of the joking kind of banter that goes back and forth between kids. So I suppose if you were to Google self-help puberty,
there's hundreds of books
on
having
them.
The talk.
Right.
I tend to just buy the ones that are related to spectrum stuff and puberty. And then your doctor's offices generally have good pamphlets too. I can't remember the name of it. If you want to email, let me go back up. If you want to email me through my website, My email address is on the website. Then I can get you the name of it. And then we had a question up here. She's going to bring up the microphone for you. Yeah.
I have a parent whose son is going to be 10 or 11, and she's concerned about puberty and masturbating, and it's totally against her beliefs. So she wants to medicate him. Mm-hmm. Like she told me she's going to go to the doctor and talk to him about it, maybe find some medication for him so he doesn't
I would be
feel that.
opposed to medicating somebody because it can really screw up puberty. And you could be morally opposed to masturbation, but puberty is a natural part of human development.
Okay.
And, you know, what if he wants to get married and have children one day? You can't take that right away from him by screwing up his puberty. I don't know any doctor who, I've heard of doctors postponing it if you get really, really early onset puberty. But any ethical doctor is not going to prevent puberty. So then the instruction needs to be much more around family morals and values and religious instruction of why they don't believe in masturbation and what to do instead when they have those urges to exercise or take a cold shower. But there's also the discussion around what if this is someone who may not get married? Because it takes, not everybody gets married. I didn't get married until I was 38. I didn't think it would ever happen. Not everybody gets married. Some people never meet the right person. Some people just don't have the social emotional communication skills. Some people never meet the right person. So you've got somebody who may never get married, and if you're supposed to wait until you get married to have sex, and they believe masturbation is the pathway to hell, then you've set somebody up for an awful lot of anxiety and depression and difficult emotions, so they need to discuss how to handle that too. Of, I have no sexual outlet, I'm never going to get married, and I can't masturbate. But then if he's human, he's going to be tempted, and then he may masturbate, and then he thinks he's going to hell. And so that's a discussion with the parents of how they want to think through that and handle that, and then maybe they need to talk to their religious advisor about how to handle that as well.
Okay, thank you.
Any more questions? You want to talk to me afterwards if you have, because I think time is up. I have a few more minutes. Okay, one more question, and then if you want to talk to me afterwards, then feel free to come
I just had a word of caution to revisit the dating rules. In middle school, it's different. High school, it's different. In college, it's different because on more than one occasion, I've had a college student take a huge amount of advantage of co-signing things, paying for all the textbooks, paying for all kinds of things.
You're my significant other, so you need to do all this for me. That one, it is an ongoing discussion. And like I said, this is normally a 3-hour presentation for me, not an hour and 15 minutes. There are whole books on this topic, so I can't even begin to go into all the issues. But absolutely, social norms change dramatically from childhood through adulthood. And the amount of gray areas and the number of issues that you don't even think about are massive. So we're going to stop here, and then if you want to talk to me afterwards, feel free to come up. Thank you.